We did it?
Mm-hmm.
I don't feel it. I don't feel it.
Good.
You're going into the veins?
Yep. So hey guys, we are now finishing up our day in clinic in Beverly Hills, and we're doing treatment called sclerotherapy. And what this is, we inject a certified detergent salt into the veins. Now some veins that are super small need lasers or would have to wait to treat, but you can see these big spiral large veins. What we do is try not to move, try not to move.
I want to see that.
We would do a little entrance into the vein, and then you inject it. You see how quickly it disappeared and spreads all throughout this patch. Okay, and you spread that through this patch,
Look at the video. You don't
and the large areas will be treated at once. And the issue is with veins, they have a tendency to want to come back frequently. So, and some of them, like that one, a little stubborn with their valves. So there we go, another one right there, a nice little branch. And you can see it spreading throughout that branch to all the areas of those veins. And what happens is the veins then get irritated, they spasm, and long term they then disappear. Often a series of treatments are needed to get the best outcome. There we go. Okay.
It doesn't hurt at all.
Very good.
I mean,
That's a good thing.
I don't feel anything at all.
That's awesome.
There we go. Is that big guy right there? Some of these just get. And so the goal is to see in a few treatments how much reduction, but this is a very baby fine needle. Get some of these larger ones here. See that? That whole patch, you see? An entire patch was treated. And you can see the spasming starting to occur, the dark red color. There's another really good one right there. Great. People that exercise or just have bad luck from genetics often will develop these sooner, but no matter what, as you age, you will get these. Everybody will get these.
Why people who exercise get sooner?
It's a lot of the pressure, tension on the skin and the muscles. So the goal is, these little ones are all too small, but you see how the majority of them spread from one vein to another. Okay, so that's a good example of kind of a large patch. Now we can go to a reticular vein, which is these deep blue veins, and you can see it spreading from here. So we're going to go into that deeper blue vein and just inject. You see it lighten up immediately. This one will burn a little more. And spread it directly into the vein. Oops, sorry, a little bit more. Good. And that will kill that one.
Crazy.
Isn't that crazy?
Over time. There's another reticular right here. Deeper right there. Good. Get that. So grab those cotton balls for me.
I think it's crazy that some people just have bad luck.
Oh my. Over here, just a small little piece.
It's crazy.
And since a lot of these are wispy small ones, they actually, unfortunately, a lot of times you have to wait until they're bigger. Unless they're in patches like we just did. Okay, straighten your leg a little bit. Turn me. You can bend slightly. There. Okay. So now, let's see if we can find some of these that will respond. That one did, you can see. See? Right there, went all the way up there.
My booty went up.
Don't worry, I was like this a month ago.
Really?
Yeah, I had the sciatic nerve issue. Like piriformis syndrome.
Yeah, I have that.
So I have like 6 doctors looking at my foot.
Okay, so we're working our way around ones that are big enough. See that here? See that? Look at that spread right there. Look at that spread. Wow, look at that. All through here. All connected. All connected. And the key is using this polarized headlamp it's the only way you can fully see very fine straighten in a second. Okay, now it's right here. Let's go to this bigger guy here. See those bigger ones, see, look at it spread all through here now. That big one that we injected just fed all of those other ones, which is great. Another very big one right here.
They should disappear. It's crazy.
It's like magic.
Yeah, it's like magic. I mean, it's like it's not there anymore. This is cool.
And some people get a little hive reaction, which is what she's getting right now.
It collapses the veins, right? That's what
Yeah, causes spasm into the vein to make them collapse over time. is this one? Yeah, let's put it, hold on, tape. A medium.
If I exercise less, am I gonna have less fat?
Hmm?
If I exercise less.
No, you can do whatever you want. Couple more.
No, don't stop exercising. I mean, that's not good.
No. So we put pressure over these veins so that it keeps them collapsed, and that's why we ask them to use a little compression garment. Hold here. Just hold here. Hold here. That's why we ask people to use a little compression garment for the next couple weeks if they can. Help speed up how much is resolved.
How many treatments would you recommend?
Well, it depends. I mean, you could have your whole... Turn the opposite way. Good. And that knee. Bring this one straight. Yeah. Hand those over.
You said it's less, little less, right?
Yeah. And straighten out. This will be a fun one to inject for people to see. And then, and you can only do so much at a time too. You can't do so much sclerotherapy. I mean, okay, so we're going to go into this reticular vein. Now, some people will actually do this, where they'll pull back a little bit and see if there's blood in there. See, there's a little bit of blood in the tip there. So that's a good thing. So we're injecting now into that vein. You can see it spreading into the vein.
No, it's not.
And what that will do is that will spread then to the local veins and kill those. Same thing here. So if you can get the deeper veins, then it will kill the more superficial veins. As you can see here, we're in the reticular vein here as well. And that's just spreading now. You can see how it's spreading throughout all of those veins. Great. So let's go over to here. There you go. Okay, that's getting most of that patch.
Are there alternative treatments to this?
Yeah,
Like
there's
laser or
lasers, but the lasers are more likely to burn, and they're very difficult to do large areas with lasers. So if you have a couple small ones, it's fine. Okay, so now that gauze and tape. So this area is good. You can get the biggest ones first, and then you work your way. Tape. Right.
I can imagine before when people don't have these treatments, how they live with
There you go. See? That whole patch. gauze and tape. Here, tape right here. Go in this direction. There. And then one more right here. Okay, let's work our way up. So this is the last area that we can do because this is the max amount that we can inject per day. Stomping the movement there. Good. You can see how many. This patch will be good. Even if you enter here. See, look. See?
Oh.
All those veins, look at all those.
Oh, is it?
All the settings are set, just full focus a little bit.
Copy.
This last one. Okay, so let's put
Mhm.
that in here. Take that away. Need that tape right here. The most important thing now is to keep it compressed. So that's sclerotherapy for leg veins, and she'll need multiple treatments over time, but tonight for 24 hours, she's going to keep this pressure on here, then she'll wear a Spanx or a compression on top for the next week or two.
I just, you know which kid's after,
Okay? That's it.